Good afternoon. My name is Bistricky, and I will be presenting on my practicum project, the LPN Academy. The LPN Academy project was designed to address staffing and professional development challenges within ambulatory nursing at Mayo Clinic. We'll cover organizational context, program development, implementation, outcomes, and future directions to showcase impactful improvements. The Mayo Clinic Department of Primary Care, with particular focus on community internal medicine or CIM clinic in Arizona, is a leader in providing comprehensive patient-centered ambulatory care. The department is committed to the Mayo Clinic mission of advancing clinical practice, education, and research. Within this environment, LPNs or licensed practical nurses are integral to the delivery of safe and effective care and the support of multidisciplinary teams. However, despite their vital role, the CIM division faced persistent challenges related to LPN recruitment and retention, which threatened the stability and the quality of care within the department. We performed a needs assessment. It included staffing patterns and workforce stability within the CIM clinic, and it revealed an urgent need for intervention. The department had been experiencing a sustained LPN recruitment crisis, mirroring a nationwide shortage and exacerbating chronic understaffing. At times, up to 8 LPN positions were unfilled simultaneously, and newly hired LPNs often resigned within a short time, which led to a high attrition rate. The ongoing turnover necessitated constant onboarding and resulting in staff fatigue, loss of institutional knowledge, and a significant financial burden due to the repeated orientation costs. In response to the above challenges, an interdisciplinary team of stakeholders, which included physicians, nurse managers, nurse administrators, education practitioners, and preceptors, all collaborated to give input on the LPN Academy. This innovative program was modeled after successful nurse residency programs for registered nurses, and it was grounded in current educational best practices. The LPN Academy was structured as a comprehensive 8-week curriculum of 1 hour sessions, integrating didactic education, hands on practice, mentorship, and opportunities for cohort based learning. The Academy aimed to support newly hired LPNs as they transition to practice, addressing gaps in professional communication, clinical competencies, and long term career development. The overarching objectives of the LPN Academy were to reduce turnover and improve retention among newly hired LPNs in the CIM clinic, provide structured onboarding, professional development, and mentorship tailored to ambulatory care environment. We also look to foster LPN confidence, competence, and a satisfaction within their role, as well as aligning with Mayo Clinic's Department of Nursing strategic plan by investing in staff and cultivating transformational leaders, creating a replicable model for other departments within Mayo Clinic and beyond. These goals were directly informed by both the assessed need for workforce stability and the organizational commitment to excellence in nursing practice. The LPN Academy spanned from late May to mid-July, with sessions scheduled weekly and facilitated by a multidisciplinary team of experienced faculty. Sessions were held both virtually on-site in the Scottsdale and the Phoenix campus, accommodating both campuses and staff on each site. The session topics and educational content that we covered was a welcome and orientation. We focused on communication tools such as SBAR and virtual etiquette. We had a session on phases of transition, patient staff event reporting, as well as delegation, magnet principles, and scope of practice. We had a skills day or skills lab where we looked at suture removal, injections, anaphylaxis management, and swab techniques, as well as quality, EBP basics, and mentorship, managing disruptive patients and behavioral health resources, as well as role delineation, professional development, and future possible opportunities at Mayo Clinic. Developing best practices that address skill proficiency, attending to the emotional needs of a new nurse graduate, and providing structured transition programs to improve clinical competence are all things that we look to add in this program. The effectiveness of the LPN Academy was measured through both quantitative and qualitative means. Pre and post course surveys demonstrated a marked improvement in participant comfort with ambulatory care topics, knowledge acquisition, and utilization of department resources. The summative program evaluation found that all LPNs who completed the academy would recommend the experience to other novice LPNs. The LPN Academy was enthusiastically received by stakeholders at all levels. Nursing leadership valued the alignment with strategic priorities, while clinical and administrative staff observed improved morale and reduced burnout as a result of stabilizing some staffing. New LPNs reported feeling supported and empowered. As far as faculty and mentor perspectives, they were involved in the academy and they expressed satisfaction with the structures and outcomes. They noted positive impact of the cohort-based learning and on the open forum for questions and concerns. Mechanisms for ongoing success and expansion. So the sustainability of the LPN Academy is ensured through a few of those mechanisms. One being dedicated protected time for LPNs to participate in all sessions. These were endorsed by each of the departments. An integration of the Academy curriculum into the annual onboarding process for new hires. An ongoing collaboration among nurse educators, administrators, and leadership to update content and incorporate feedback. Expansion plans to other ambulatory departments based on the Academy's success. We had a lot of inquiry into how this could come to other departments. As far as continuous monitoring and program refinement, the LPN Academy continues periodic and outcome monitoring and stakeholder engagement that will be used to refine the program and ensure ongoing relevance and value. We have reached out to contacts within other departments, asking for ongoing feedback of those LPNs that participated. As the project lead, I set several professional development objectives that were aligned with AONL, and those included demonstrating effective communication and relationship building skills through an interdisciplinary collaboration and facilitation of the cohort learning, as well as developing a strategic and evidence-based approach to workforce challenges by applying principles of financial stewardship. I also advanced professional self-regulation, lifelong learning, and capacity for mentorship. Promoting a culture of safety and patient-centered care through education and clinical competencies and event reporting, as well as by building leadership abilities to guide a project with measurable impact on both staff and organizational outcomes. Some of the key insights and takeaways from this project were that intentional structured onboarding and mentorship are critical for the successful transition of novice LPNs. Interdisciplinary collaboration enhances program design and effectiveness, and performing regular assessments and an adaptation of educational programs are definitely necessary to meet evolving workforce needs. Investment in the workforce development leads to tangible improvements in retention, staff satisfaction, and organizational performance. And leadership in nursing must be proactive, responsive, and grounded in both evidence and empathy. Ultimately, the LPN Academy not only addressed a pressing staffing challenge, but it also advanced the professional development of both the participant and myself as the project leader. The experience deepened my understanding of change management, curriculum development, and the power of supportive, transformative learning environments. The LPN Academy project has demonstrated to me a successful model for advancing ambulatory nursing practice through education, collaboration, and leadership development with promising outcomes for staff retention and patient care quality. Thank you.